wife of the Delta State Governor and founder of Human Charity Foundation, Deaconess Tobore Oborevwori, has disclosed that over 331,919 girls in the state between the ages of 9 and 14 years have successfully been vaccinated against Human Papilloma Virus, HPV. Deaconess Oborevwori disclosed this at the official launch of the Girl Effect Oya Campaign on Human Papilloma Virus held at the Unity Hall Government House, Asaba, the Delta State capital. Represented by the wife of the Deputy Governor, Lady Catherine Onyeme, Deaconess Oborevwori said Delta State has made remarkable progress since the Human Papilloma Virus vaccine was introduced in the state on May 27, 2024. According to her, the progress is a collaborative effort of health workers, government agencies, development partners, and the unwavering efforts of parents and guardians.
I am honored to stand before you today at the official launch of the Girl Effect Oya Campaign, an initiative dedicated to increase the uptake of the Human Papilloma Virus (HPV) vaccine and promoting good nutrition among adolescent girls across Delta State. I extend my heartfelt appreciation to our esteemed Governor for his unwavering commitment to the health and well-being of our people. His leadership has been instrumental in creating an environment conducive to life-saving interventions such as this. The HPV vaccine remains one of the most effective tools in our collective fight against cervical cancer, a disease that disproportionately affects women and continues to claim lives that would otherwise be saved. I am proud to share that since the introduction of this HPV vaccine in the state on May 27, 2024, we have made remarkable progress. As of April 2025, we have successfully vaccinated over 331,919 girls aged 9 to 14 years. This achievement is a testament to the collaborative efforts of health workers, government agencies, development partners, and the unwavering support of parents and guardians. However, our work is far from over. The launch of the Girl Effect Oya Campaign today marks the next phase of our efforts, not only to expand HPV vaccination coverage, but also to integrate vital nutrition education that will equip our girls to grow into strong, healthy women. The term Oya resonates with urgency and action. It is a call to our communities to take proactive steps in safeguarding the health of our young girls.
Earlier in a welcome address, the country director, Girl Effect Nigeria, Boladele Akinkolakpo, said Girl Effect is a global non-profit making organization committed to empowering adolescent girls and young women by addressing the root causes of the challenges they face. Akinkolakpo applauded Deaconess Tobore Oborevwori for her warmth and unwavering support, leadership, and dedication to advancing the health and well-being of women and girls in the state. She disclosed that the launch of the Effect Oya campaign in the state was a testament to what can be achieved when public institutions, development partners, and communities come together in pursuit of a shared vision, ensuring that every girl has the knowledge, tools, and support she needs to live a healthy and empowered life.
The essence of this gathering is to launch the Oya campaign. The Oya campaign is a call to action and a movement by Girl Effect to ensure that our girls are vaccinated against the HPV virus. And it's something that the government of Nigeria is pushing alongside with Gavi, the Vaccine Alliance. And Girl Effect, being a reliable partner, is also working in the space. We work with girls across the world to ensure they attain their full potential. And so cervical cancer is a deadly disease and is killing a lot of our women. In order for us to prevent that and to secure the future of our girl children, we are saying, yes, get vaccinated, and the time is now. Hence the campaign Oya, which means Oya, let us go. Oya, let us act now. We do a lot of community mobilization to dispel all those rumors and myths and fears around the vaccine. The vaccine does not have anything to do with fertility. It does not stop a girl from getting pregnant in future. WHO will not be here, UNICEF will not be here partnering with us on this campaign if it was not safe. And so it's important for our children and our mothers, our gatekeepers, to be knowledgeable about what this vaccine can do for their girls. That's why we're here. That's why we're ensuring that we're empowering people with information that is useful for them to take informed decision about the health of their children. Vaccine is free across all our public health facilities. And Girl Effect is currently in Delta State. We are implementing in 2 LGAs. But now, because of the awareness, we are expanding into 5 additional LGAs. We are in Lagos, we are in Kano, Kaduna, Ondo, Ekiti, and Oyas State. We've done this across those 4 states, and the last one will be Kaduna. So it's safe, it's free, and we started this implementation last year on the Girl Effect platform, but the government of Nigeria has been pushing for this for a couple of years now. So we doing this is to ensure that all efforts from the government side, from the partner side, are being unearthed so that we can get far if we come together. So yes, it's safe. And that's the message I would want to pass across. The vaccine is safe, Girl Effect is saying it, WHO is backing it, and the government of Nigeria is in support of it.
In her remarks, the Delta Community-Based Organization and Executive Director, Noble Delta Women for Peace and Development Initiative, said the complete well-being and good nutrition is the foundation of strength, growth, cognitive development, and resilience of every girl child.
So to the parents is that the time is now. There is call for emergency against cervical cancer. And the emergency is that all our children aged 9 must get vaccinated to prevent future cervical cancer. And then to our community leaders, they are fathers and mothers of the girls that we are talking about. Everybody must get involved. It's a call for emergency. That's why we said it's Oya, let's go. And of course, you know that Oya is a Niger Delta term, that there is call for emergency, and that is it. Because without good nutrition also, the children cannot kick out that cervical cancer and related diseases. So this Oya campaign is about creating awareness for the prevention of cervical cancer through the HPV, Human Papilloma Virus vaccination, and as well using the app initiative to train them on good nutrition.
Representative of World Health Organization and UNICEF in Delta State and Predia Link Association Nigeria gave more insights to the HPV vaccine.
And promoting good nutrition practices among adolescent girls in Delta State. This campaign is timely, considering the fact that, based on statistics, globally, cervical cancer is the 4th most common cancer among women, yet it is almost entirely preventable through vaccination and early screening. In Nigeria, over 14,000 new cases of cancer are diagnosed every year, with approximately 8,000 deaths are recorded yearly. So the HPV vaccine, when administered to girls between the age of 9 to 14 years, offers up to 90% protection against HPV strains responsible for cervical cancer. The federal government, in collaboration with partners, have introduced HPV into the routine immunization schedule in 2023. As of today, it is being rolled out across all the country. Delta State is among the states leading the effort, and the Oya campaign represents a proactive, integrated model that combines vaccination and nutrition education, a crucial component of adult health and immunity. The inclusion of nutrition awareness in this campaign is both strategic and necessary. Nutrition is fundamental to health. Malnutrition in all its forms undermines economic development, increases health costs, and weakens human capital.
Claim so many lives across the world. Just as we protect our children against polio and measles, this is another shield for our children. They need to be protected. To our wonderful daughters, our girl child, you are the heart of this campaign. Good nutrition fuels your dream. Vaccination protects your future. Together we are saying, Oya, now is the time to invest in your health, education and empowerment, and UNICEF stands with you. To our healthcare workers, your dedication makes this possible. To the media, your advocacy amplifies our effort and impact. Together, let us champion the health and empowerment of our daughters. The Oya campaign is our commitment to the future where every girl child shines.
The visionary initiative, it aligns closely with our core mission of advancing the health and well-being of every child in Nigeria. And the adolescent is very pivotal because the girl child is actually the one that cares for the home. HPV vaccination and proper nutrition, they are critical pillars to safeguarding the future of girls. By addressing this area head-on like we are doing in this Oya campaign, it is not just preventing cervical cancer, which we have all said is a killer, it is tackling nutrition and it's empowering a generation of girls to thrive, to learn, and to live in dignity, because sometimes cancer can take out the dignity in you. We commend the Girl Child Effect for their tireless efforts because we looked through and we saw the work that they are doing in connecting young girls to life-changing information and service. We applaud the Delta State government, the Delta State Ministry of Health, the Delta State Primary Healthcare Development Agency for creating an enabling environment from when the HPV vaccine was launched in May up to this point in Delta State, and for creating interventions to succeed. Pediatric Association of Nigeria, we care for children and we are proud. We are happy to stand along with you in this transformative journey.
Quest Charles Kosipi reports that the Oya campaign aims to use the HPV vaccine, data, media, technology, and community engagement to shift harmful norms, expand access to accurate health information, and promote behavioral change. Another goal is to help girls see themselves differently and make healthier decisions for their lives.